Hello, everyone. Let's talk about something that's often misunderstood: attention deficit hyperactivity disorder, or ADHD. There's a lot of information out there, and sometimes it can be confusing. It's important to clarify that ADHD is a complex neurodevelopmental condition, not a personality trait or a sign of laziness. It affects how the brain manages attention, impulse control, and activity levels. You might have heard friends or family members mention it, or perhaps you've seen discussions about it online. What's crucial to remember is that ADHD is a clinically diagnosed condition, and understanding its common characteristics can be the first step toward getting the right support if it resonates with your experiences. This discussion is purely for informational purposes, to help you understand what ADHD might look like and, most importantly, when and why it's essential to consult with a qualified professional. So let's explore some common characteristics often associated with ADHD, and then we'll discuss the critical next steps if these resonate with you or someone you care about. But before we continue with the video, let us know the problems you are facing mentally or emotionally in the comments, and we'll try to make an unfiltered and raw guidance video like we always do. Also, make sure to subscribe to the channel and like the video if it's helpful to you in any way. 1. Difficulty sustaining attention. One of the most recognized characteristics is difficulty sustaining attention, especially on tasks that aren't inherently stimulating or interesting. This isn't about choosing not to pay attention, but rather a challenge in maintaining focus over time. It might manifest as struggling to complete tasks, getting easily distracted during conversations, or frequently losing track of details in everyday activities. 2. Problems with executive function. Individuals with ADHD often face challenges with executive functions. These are the mental skills that help us get things done. This can include difficulties with organization, planning ahead, prioritizing tasks, managing time effectively, and starting or finishing projects. It's not a lack of intelligence, but rather a hurdle in organizing and executing steps toward a goal. 3. Hyperactivity or restlessness. Depending on the presentation of ADHD, hyperactivity or restlessness can be prominent. This might look like fidgeting, squirming in seats, excessive talking, or an internal feeling of restlessness even when outwardly calm. In adults, hyperactivity might be less overt, manifesting as an inner drive, difficulty relaxing, or a constant need to be doing something. 4. Impulsivity. Impulsivity is another key characteristic. This can involve making quick decisions without considering long-term consequences, interrupting others frequently, blurting out answers, or acting on urges without thinking them through. This isn't a lack of discipline, but a challenge in pausing and considering before acting. 5. Emotional dysregulation. While not a core diagnostic criterion, emotional dysregulation is very commonly associated with ADHD. This means experiencing emotions intensely and having difficulty managing emotional responses. It can lead to quick shifts in mood, heightened frustration, or feeling overwhelmed by emotions that seem minor to others. 6. Forgetfulness and memory challenges. Frequent forgetfulness and memory challenges can be a daily struggle. This isn't about severe memory loss, but rather difficulty recalling details, appointments, or where everyday items were placed. It relates back to challenges with attention and organization, making it harder for information to be properly encoded and retrieved. 7. Time blindness. Many with ADHD experience what's often called time blindness. This is a difficulty in accurately perceiving the passage of time. Minutes can feel like hours, and hours can feel like minutes, leading to chronic lateness, underestimating how long tasks will take, or struggling with deadlines.